Our world is changing. At no time in history have we been so connected by technology, so empowered by innovation. Many of us are living longer than any generation before us, a direct result of better nutrition and sanitation and improving healthcare. Universal access to medicine is undeniably transforming lives. Yet at the same time, the growth in pharmaceuticals across the world also raises the threat of adverse reaction to drugs. To help protect patients, we must ensure the public are not harmed by the very medicines created to cure them. Today, this watchdog role is being played out in 150 countries by the Uppsala Monitoring Centre and its global health partners. Established 4 decades ago and bearing the name of the small Swedish city where it was born, the centre might be little known to the wider public, yet it has a profound impact in our daily lives.
Uppsala Monitoring Centre was established 40 years ago to support the World Health Organization network of countries working together for safer use of medicines. My name is Marie Lindqvist and I'm the director of UMC. From day one, our ambition was clear, in collaboration with WHO, to work with partners across the globe to encourage reporting of adverse effects of medicines, to record and understand them, and reduce the risk of their happening again. This is the safety monitoring of medicines, the science known as pharmacovigilance. It's been a partnership without borders that has reached nearly every corner of the globe. It's a genuine global collaboration, people by all ages and diverse backgrounds.
The principal goal of UMC remains the same as it was when the organisation was first founded: to use the power of data to create an enduring global safety culture around medicine. But to be truly effective, the organisation must collaborate with partners from every corner of the globe. Successful pharmacovigilance is about building partnerships alongside people with a deep sense of purpose. Health professionals in Cape Verde, like Jamila Rees.
Health is a fundamental human right. My journey is to cause an impact and assure that people has access to medicine. My brother and I jokes that was a legacy from our parents. They were so connected with this struggle for the independence of Cape Verde, of serving Cape Verde, that we are both public servants. The discussion was how to be useful to Cape Verde, how to make this country a better place. This gave me a sense of purpose. Being a pharmacist, I always related this with medicine. Medicine serves a purpose that's helping people.
As we enter a new age of innovation, improvements in clinical data, electronic health records and social media promises to narrow the chances of adverse drug effects. But in island nations like Cape Verde, pharmacovigilance remains largely unheard of, despite at times being the difference between life and death. In such remote locations where internet connectivity is not universal, face-to-face advocacy and education remains at the core of public health missions to teach the public about medicine's use.
The unique challenges here in terms of pharmacovigilance in Cape Verde. We know now that people really don't understand what is a medicine, how to use it correctly, that the medicines also have a risk when you take it. An example is the use of a medicine that should be used as a gastric protector, but it's being used for abortion by adolescents. And then they reach the hospital. Sometimes it's possible to save their life, but they will never be pregnant again, they'll never be mothers again. We want a better use, a safer use of the medicines. The patients are really the reason why we're doing all this.
Today, the medicine safety community is being shaped by like-minded health professionals across the world. In Zagreb and across Croatia, Darko Krinic, the head of the pharmacovigilance section at the Croatian Medicines Agency, HALMED, works closely with doctors, pharmacists, nurses, regulatory authorities and pharmaceutical companies to ensure the safety of all patients. A role for him that is also driven by a desire to build a lasting healthcare legacy for his young and ambitious country.
Most people believe that medicines are 100% safe. It is true that they save lives, but they also carry a risk. That balance between benefit and risk needs to be a global conversation. I see this with my team at HALMED. To me, they are an example of this new generation, driven and passionate and working towards achieving positive change in society. And I'm proud of them.
For trained doctors like Darko, pharmacovigilance is not just about securing the safety of patients in his own country, but sharing knowledge on everything, from the smallest local reaction to a simple aspirin, to global ideas for enhancing public awareness around medicine's use. In order to improve practice, lessons and learnings must be shared across international borders, not only to save lives, but also to help defeat a very modern blight: fake news and misinformation.
In this professional journey I'm on, I realized that more I travel, the more I understand that we are all the same. We all need healthcare. Many of us need medicine. We need to be safe and also ensure our loved ones are protected. We might speak different languages and come from different cultures, but the end result is the same. We all want to improve global healthcare. In this age of misinformation, there are many different opinions on major issues, and vaccination is a great example of divisive issue where if people make the wrong decision, it could jeopardize the health of their children. What is more important than a child's health? I firmly believe in protecting children, the next generation, empowering them with any means necessary to fight disease. I'm a parent first and doctor second, and so I take solemn position through my work on my responsibilities to fight for the rights of the child who doesn't have a strong voice, a clear voice on their own fate. So as leaders in our field, we need to be brave and clear. Through this commitment, we must build knowledge based on trust and integrity. Decades may have passed since the war here in the early 90s. What the war gave us here in Croatia is this strong sense that we are in this together, that we can help our neighbor, and that has stuck with me. It's at the heart of Croatia's resilience and capacity to recover and, above all, heal.
UMC exists to provide methods, tools and training that empowers and informs our partners. But there is more to the organisation than this. UMC's journey over the past 4 decades teaches us that the most powerful weapon we have against adverse drug reactions is leaving no stone unturned and no one person ill-informed about medicine.
From the very beginning, we have focused on developing a strong support network of people passionate about pharmacovigilance. We work with partners across the world to encourage reporting of adverse effects of medicines, to record and understand them and reduce the risk of their happening again, no matter where. Modern healthcare has brought enormous benefit to all of us, but no medicine is 100% safe for all people. Every time a treatment decision is made, the doctor and patient must decide if the benefits are sufficient to accept the possibility of discomfort or harm. This is why we need to talk about medicine safety and report any adverse effect. The more we know about what patients have experienced, the more all of us can be accurately informed and harm can be prevented in the future. That's what our work is all about. We are scientists at UMC, but we never forget that the focus of our work is the safety and health of individual patients across the world.
For dedicated pharmacists like Magali Tito Yepes, overcoming the physical challenges of mountain ranges and rainforests in her native Peru requires exceptional creativity and resilience to keep patients as safe as possible. Here in South America, gathering data on drug safety and educating doctors and patients alike in countless different languages can often involve journeys by foot in Andean peaks or by canoe along the Amazon. It is a daunting day-to-day job without geographical boundaries.
Mi mamá era enfermera, entonces pasaba largos momentos en el hospital. Era casi como mi casa. Y mi función principal es monitorear la seguridad de los medicamentos en todo el Perú. Trabajo de la mano con la industria farmacéutica, con todos los profesionales de la salud que trabajan en los diferentes establecimientos de salud. Hablamos de las clínicas, los hospitales, centros de salud, puestos de salud. Y también trabajamos con los pacientes. El objetivo final es identificar cualquier problema relacionado con el uso de los medicamentos. No solamente hablamos de reacciones adversas, hablamos de cualquier consecuencia negativa, es decir, la falta de eficacia, errores de administración que pueden tener un efecto negativo. El objetivo siempre es prevenir y evitar cualquier riesgo innecesario. En nuestro país hablamos de comercio ilegal cuando encontramos medicamentos vencidos, presuntamente falsificados o procedentes del contrabando. Trabaja con un equipo multidisciplinario, hablamos de la policía, la fiscalía, otras autoridades, organizando operativos a nivel nacional para identificar a estas personas, aquellos que venden este tipo de productos y retirarlos del mercado. A lo largo de toda mi carrera, he trabajado en diferentes instituciones del Ministerio de Salud, incluyendo hospitales. Mi objetivo siempre fue tratar de prevenir y minimizar cualquier riesgo asociado al uso de los medicamentos. Perú es un país geográficamente muy complejo. Está dividido en los Andes en su corazón y rodeado por el océano y el Amazonas en sus fronteras. Atravesar un entorno de este tipo es un gran desafío cuando se trata de proporcionar atención médica. Tiene un gran reto relacionado con los medicamentos. Aún existe mucha pobreza en este país, lo que dificulta el acceso a los servicios básicos de salud. Tenemos comunidades muy lejanas donde la distancia se convierte en el principal obstáculo para acceder a un medicamento o un tratamiento. Las personas tienen que caminar largas horas, largas distancias para llegar a un establecimiento de salud. Y no siempre, cuando llegan, pueden acceder al medicamento porque no disponen del dinero suficiente. Esta situación es a veces aprovechada por personas inescrupulosas que venden medicamentos de baja calidad a un bajo costo y que lejos de ayudar este medicamento puede representar un riesgo para la salud de ellos. Esta situación plantea un desafío para nosotros, para la Dirección General de Medicamentos, en cuanto al control de los tratamientos del medicamento en sí. Debemos continuar trabajando con los profesionales de la salud, universidades, la propia industria farmacéutica para fortalecer la farmacovigilancia y crear conciencia sobre la importancia de establecer una comunicación estrecha con los pacientes. Conocemos los problemas, entendemos los desafíos y creo que en realidad estamos teniendo un impacto.
Yet whilst technology brings the promise of greater reach for the pharmacovigilance movement, it also brings the emergence of lawless online markets and the growth in fake medicine sales. This is particularly true in regions like North Africa, where neighbours are inspiring each other to adopt more robust strategies to fight against the threat of harmful medication and weak regulation. Here, Rashida Suleimani, the director of the Poison Control and Pharmacovigilance Centre of Morocco, is turning to the airwaves to deliver the clear message that we mustn't take the safety of our medicines for granted.
Morocco is geographically and culturally complex. We are a bridge. We are on the cusp of Europe and we stretch down into Africa. The use of medicines has exploded in Africa with 80,000 drugs on the market, but regulation often falls short. Across Africa, the consumers don't often have enough information about the medicines they are taking. The internet adds to the lack of regulation. For example, people in Nigeria can buy medicines from China, so we face enormous challenges across our continent. Pharmacovigilance is much more than medicine safety. It's about building trust among the public. It's about people and making them believe in the health system structure from top to bottom. Education is paramount to everything. Knowledge is power. How do we reach nomads in the Sahara and at the same time be relevant to urban commuters in Casablanca? Well, for a start, we diversify our approach. We work with a network of nurses, doctors, and pharmacists across Morocco. This collaboration gives us an opportunity to carry the same messages to millions of people. Here, geographically is still a challenge, and we must utilize the media successfully. In Morocco, radio is incredibly popular, and the airwaves offer us the opportunity to cross mountains. Even nomads in the deep Sahara carry transistor radios. People all over the country listen to radio on their phones. And this offers us a direct connection to people. We must look to social media, to connecting with audiences, to use the advantages of technology to reach people who have never heard our message.
Today, innovation is undoubtedly democratizing access to life-changing medicines and creating cures against diseases that have blighted society for centuries. Yet, like many other sectors, healthcare is also entering a period of rapid change. The advance of new technologies and discoveries are among the many factors propelling patient empowerment in developed countries. For Dorothy To, Director of HSA, the Drug Regulatory Authority in Singapore, it's a journey that is fundamentally changing how we prevent, diagnose and cure diseases.
Singapore is a classic example of a melting pot with many cultures and communities living together. So as a society, we look at the child and we look at the future
And I think the government's vision is to ensure that everybody lives healthily, takes care of their health from the time when they are young, all the way to when they're maybe more senior. And I think these count for one of the reasons why Singapore has one of the lowest GDP spending comparatively. I think in this digital era, pharmacovigilance should be looked at in a more sophisticated manner. People's gene could just be on a smart card, or maybe our information is just in our handphone, where we can just tap when we go into the hospital and the doctor knows all about our genetic makeup. We can personalize medication for each individual, and actually it contributes a big way to pharmacovigilance, because as we customize medications, we might reduce side effects, we might increase the efficacy of medications taken by individuals or patients. The knowledge that we have in the application of pharmacogenetics is only at its infancy. I think there's a lot of room for expansion and growth. Now we need more collaborations to be able to uncover such genetic markers within the global population. And these markers may differ from country to country or from population to population. And I think it's important that we come together and collaborate so that we can bring pharmacovigilance to another level of sophistication and advancement to prospectively protect public health.
The world I hope for is a place where science and new technology are used wisely to achieve safer health for all. One of the most important developments for the future is to shift mindsets from just gathering data to understanding it and acting upon the new information. If we move focus from data collection to analysis and good decision making, we will be able to prevent avoidable harm. When we began our work, the enormous impact of data was something we were only beginning to understand. Today, the power of data influences the speed at which our world moves, drives our economies, shapes our communities, and helps us overcome societal problems on a scale never before imagined. There will be a future in which technology will help us much more than today to monitor the effects of medicines for every patient. But we still rely on the vigilance of health professionals and patients. What we learn from each patient can help every patient. To touch the lives of patients and help them to be healthier, we must engage everyone in building a safety culture for the future. We must create a culture of openness and trust, where patients and health professionals can report problems without fear, and above all else, where we learn from mistakes and build on collective experience.
The UMC's growth from a small team in Uppsala to a global movement has been a journey without borders, one driven by purpose, passion, and a commitment to the patients they ultimately serve. For the organisation's health professional partners, the challenge of geography is thankfully diminishing. They're increasingly on the same page, learning from each other each day, constantly communicating on risk, and reaping the rewards in a world where distance is no longer a barrier to cooperation. As health professionals, we are kindred spirits. We're all different, but we share the same profound commitment to improving healthcare for the most vulnerable in society, and above all, to saving lives. UMC's guiding principle from its founding remains unchanged: to be the warning sign against adverse drug reactions across the world. But unlike the lighthouse, we no longer stand alone.